Hello, Sierra Nevadans. It's Dr. Evans with another update about how things are going down here at the hospital. One thing people have been asking and wondering about is it safe to come into the hospital? And the answer is yes. We've been doing a lot to make sure that every surface is clean. We've got processes to take care of patients in the emergency department. We're back up and running with our screening tests in Building 4, which is where we do things like mammograms and other x-rays. And everybody is ready to go. So if you've got preventative stuff that needs to be dealt with, if you've got a screening test that needs to get scheduled or labs that need to be drawn, or if you need to come into the emergency department, we are ready for that. We're open and available for you. So people have also been asking, actually, what about office visits to go see my primary care doctor? And I know that a lot of the physicians in town have really been working on making sure their offices are safe. Many of them are doing telemedicine visits, and they're doing lots of other things to just make sure that the process is very solid and comfortable for all the patients. So with a little bit more on that, I'm going to turn it over to my colleague, Jill Fitzpatrick. Dr. Fitzpatrick is the medical director for the Dignity Health Foundation Medical Group here in the community, and she's been very busy lately, so we're going to turn it over to Dr. Fitzpatrick. Thanks.
Hi everyone, this is Dr. Jill Fitzpatrick. I'm a family medicine doctor and the medical director at Dignity Health Medical Group here in Grass Valley. I know that a lot of you have had your patient visits rescheduled, canceled, postponed, delayed because of the COVID-19 concerns. And now that the doctor's offices are starting to reopen, you might be wondering if it's safe for you to come back to your office visits. So I'm hoping I can answer some of those questions for you today. I do want to mention to you that all of the local doctor's offices are following the guidelines from the Centers for Disease Control as well as the California Department of Public Health as we are creating our protocols as we open our clinics. So first of all, we're following very strict cleaning and disinfecting guidelines. All of our common areas are being cleaned multiple times per day, and our exam rooms are being cleaned after every single patient visit. Second of all, we continue to follow social distancing recommendations. And by that, what we're doing is we're staggering our patient visits and we're limiting the number of people that can be in our waiting rooms at any given time. Lastly, we have symptom screening and we have masking requirements at all of our buildings. So when anyone comes into our buildings, whether that be a physician, a staff member, a patient, a visitor, a vendor, everyone is getting asked questions to see if they have any symptoms that could represent COVID-19 like illness, and they're requiring masking. We would be really happy if you would bring your mask with you to your visit, please. So I also want to mention that any delays in patient care can also have consequences. So I'm hoping that this information today will help you to come back to your doctor's office visits and feel confident and stay safe and stay healthy.